Hello, I'm Steve Heward with the Sarasota County Health Department. I'm joined today by Chuck Henry, our health officer for Sarasota County, and we're here to talk to you today about where we're at with COVID-19 in Sarasota County. So with that, Chuck, could you give us a little bit of advice on where we're at with COVID-19 currently in Sarasota County?
Sure, Steve. I think everyone's aware that the level of virus in our community, both in Sarasota and across the state of Florida, has increased dramatically in the last couple of weeks. So that's become a big concern, primarily because our hospitals are beginning to fill up with sick individuals. And about 90% of those individuals are unvaccinated. So we're really now making a plea for anyone unvaccinated to look at the data available, study the information, call and ask questions, and consider getting vaccinated, because that's really what's going to protect our community.
Now, Chuck, one of the things that I've heard a lot about is the ages of the people who are now going into the hospital and ending up on ventilators. And can you talk a little bit about how the ages have dropped for the people who are being infected with COVID?
Early in our pandemic, it was primarily our elder citizens, 65 and above, that were getting the most ill and being hospitalized in the ICU on ventilators. Today, that age is in probably the 50s, high 40s, 50s, so it's a younger population. And we consider this a preventable disease. Vaccines have been very effective at limiting the severity of the illness, preventing hospitalizations, and preventing death.
So that's very important. We really do need to stress the need for vaccines and vaccinations. Now, we're coming into the new school year here in the next week or so. What can you tell parents who have children who are age 12 or above in schools about the vaccines, or even what advice would you give to those people who have younger children in school that are not able to be vaccinated at this point?
Well, vaccines for school-age children have been a cornerstone of public health in our community for years, and the COVID vaccine is really no different. It's safe. It prevents illness, it prevents hospitalization, and we are seeing an increase in children in the hospital and severely ill. Not huge numbers, but for me, if it's preventable, we should try to prevent it. For those 12 and above, the Pfizer vaccine is available. It's available at multiple outlets, and we'll share that information here shortly. For those under 12, there is no vaccine that's been authorized at this point. We're encouraging parents to think about masking. Masking is the best defense we have, short of vaccines, to prevent illness. And I know that's a tough personal decision for many parents, depending on the age of their child. But what I don't want to see is individuals students that come home with the illness, maybe asymptomatic, and then spread it to parents or grandparents that then have a really negative outcome with the disease.
So Chuck, that's really important information for the community and for everyone to know. If you do have a child in Sarasota County schools, this upcoming year, and you'd like to have that child vaccinated, we offer all 3 vaccines here at Sarasota Department of Health in downtown and in Northport, and we do that Monday through Friday between 8:30 a.m. and 4 p.m. It's a very easy and simple process. Takes about 20 minutes of your time, and you can get any of the vaccines that you would want. Obviously, for children, it would be the Pfizer, because that's the one that is currently authorized for them. Chuck, do you have any final comments for the community?
Well, just especially for those with children 12 and above that are authorized to receive the vaccine, they can do that in combination with their standard back-to-school immunizations and do those in the same visit now, so that makes it really convenient.
That's really great advice. Now, one last question for you that I just thought of. We hear a lot about masking again, and we're being asked to mask up as we go into buildings. You and I are a good 6 feet apart, so we're not using a mask right now. But what would you encourage the community to do as far as masking goes moving forward?
Well, I look to CDC for guidance, and I know that guidance has switched back and forth as new information becomes available. For me, for myself and my family, we've gone back to wearing masks when we're in indoor environments like grocery stores where there's other people around, even though we're fully vaccinated. I think it's wise for people to consider doing that, because vaccinated people can still acquire the virus. The numbers are pretty low, For our community, it's somewhere around 10%, which is right in line with what we think, because the vaccines were not 100% effective ever. But you may acquire the virus and be asymptomatic and still be able to spread it to others. And so, for the safety of your family and others you come in contact with, we're encouraging people to mask up when they can't remain social distance, especially if they're in indoor spaces with a lot of people.
Okay. Chuck, thanks for taking the time with us this morning. Everyone out there, if you're not vaccinated, now would be a great time to consider it. We're happy to provide whatever education or information anyone in the community would like to have before receiving the vaccine. And again, we're here 8:30 a.m. to 4 p.m. offering all 3 vaccines to the community. Thanks for watching.